Welcome everyone to our Dr. M. Alfred Haynes lecture series. This is co-sponsored by the Urban Health Institute and also the Office of the President. It is lovely to see the faces of CDU, our CDU community, and also our external partners. This is just an overview of our agenda today. We have a very exciting Dr. M. Alfred Haynes lecture in store for you. Next slide. At this time, I'm going to go ahead and turn it on over to our President and CEO, Dr. David M. Carlisle.
Well, thank you, Dr. Partlow, and as always, thank you for your role as Director of the Urban Health Institute. I want to welcome everyone to our Alfred M. Haynes lecture. In a few minutes, Sylvia Drew-Ivy is going to tell us a little bit about Dr. Haynes and why this lecture is important, and especially maybe the special relationship between Dr. Haynes and the particular topic that we're talking about today. So I'll leave you all wondering, what is that relationship? And it will become evident in just a few minutes. But I want to recognize our speakers today, our Dean from the College of Science and Health, Hector Balcazar, as well as our presenter, Dr. Sheba George from our faculty as well. Thank you. And let me say also, I want to appreciate or extend special recognition to our funders of this project, from Cedars-Sinai, very much, thank you very much, as well as funding for the Urban Health Institute itself and the National Institute of Minority Health and Health Disparities. So thank you all very much. Welcome to this year's Alfred M. Haynes lecture, and I'm looking forward to it. And I will turn things over now to Special Assistant Sylvia Drew-Ivy for a bit about Dr. and Professor and former President Alfred M. Haynes.
Thank you, Dr. Carlisle. This is an exciting afternoon. It's always wonderful to have a program of great leadership at CDU, and to do it in the name of a very, very special person, Dr. M. Alfred Haynes, who was called in the very beginning, before we were even born, to ask, what kind of students should we try to get to come to CDU? What would make the best kind of student who is really going to be committed to community upgrade, community service, investment in the people in our communities? So he was there even before we had our first dean. And then when we had our first dean, Mitchell Spellman, he was collaborating all the time with Dr. Haynes, trying to get him to come out in the beginning. So ultimately, they got him to come. You know, Dr. Haynes was a physician, epidemiologist, professor, a dean, but in all of those roles, he was always dedicated to community service to reduce health disparities. That was his mantra. That was his mantra. And in every role that he held, and we had to pull him away from Johns Hopkins. Johns Hopkins just loved him and said, this is a visionary person. You know, we want to keep him. But like so many others, he came because of the opportunity that CDU offered to build that into an institution, which Dr. Carlisle is now really building the institution of CDU. And so I just thank you for participating today and celebrating, as we do this, one of our founding leaders, and we're following with new leadership today that carries that same passion for community service in their hearts. So thank you very much.
Thank you very much, Sylvia and Dr. Carlisle, for providing terrific greetings. You heard about the legacy of Dr. M. Alfred Haynes, and definitely this particular lecture series really follows along those same lines. We intend to really elevate and promote awareness and engage discussion around health disparities, social determinants, policy, educational approaches for advancing wellness in underserved and under-resourced communities, really all at the heart of Dr. M. Alfred Haynes' career. Next slide. Thank you. It is indeed a pleasure to introduce our featured speakers today. Dean Balcazar became Dean of our College of Science and Health in 2016, early 2016. He has extensive experience as a leader, as many of you on the Zoom call know, in public health, research, service, community outreach, working with community health workers, and specifically, he focuses on the study of public health problems of the Latinx community. He has over 180 publications, including 103 peer-reviewed journals. He is joined by Dr. Sheba George, who is a social scientist. She's also associate professor at CDU and also at UCLA School of Public Health. Her scholarship has really encompassed a large area of topics, all focused on health disparities. She's certainly committed to the field. She is the director of the Community Health Worker Academy, focused on health professional training and also the community health workforce. And she has over 50 peer-reviewed publications, including various awards, and also several co-authored books and a sole authored book published by the University of California Press. Today, they are presenting on the CDU Community Health Worker Academy, building innovative standards-based training for workforce development in clinical settings. Ladies and gentlemen, please join me in providing a warm welcome to Dr. Sheba George and Dr. Hector Balcazar. I'll go ahead and turn it on over to you both.
Thank you, Dr. Parlow, very much. Dr. George is going to bring our slides. Thank you, Dr. Carlisle and Sylvia and all the CDU family. We'd like to welcome you. We also like to welcome our dear colleagues and participants outside CDU. We are very grateful for your presence here today. So the next slide, we're going to tell you a little bit of of the story of how the community health worker model, the next one, was initiated. So it all began 5 years ago when I first came to CDU. A few months later, I was able to present to the CDU community some work that about community health workers and the intersection with public health and medicine. And that at that time, I had the privilege of meeting Dr. George. And so from the beginning, we both had a lot of things in common. She was also working for community health workers in different components of it. So we began to start talking and collaborating. And as we began, we also had this opportunity with Juan Mendez. Juan Mendez is a CDU alumnus from our Masters in Public Health. And he works in Providence. So he approached me and said, Dr. Balcazar, I know that you work in community health workers, and we have been in Providence working with the community health worker model for many, many years. But one thing that we have really not done well is in somehow provide a standard approach to training. And we want to really understand what are some of the standards that we require in this field for building up that interjection between community health workers and the health clinics. So that began our functional program. 5 years later, we have developed and continued to do our commitment to health equity. and develop these important elements of the workforce for community health workers in terms of training, research, education, and advocacy. So we're going to tell you a little bit about our accomplishment for the last 5 years. And we will then dwell into the specifics of the model of the innovative approaches that we have done with this training. Dr. George.
Yes. Thank you so much, Dr. Balcazar, and thank you to all of you who are here, especially the leadership of CDU who are here and have given us leadership in this work and allowed us to really flourish with this work that we're going to share with you, and our partners, several of whom who are here with us. So thank you so much for the welcome. So we're just going to talk a little bit, about our accomplishments. And this slide just gives you a little bit of an overview of what we want to share with you, what we're so excited about. In this past 5 years, short years that Dr. Balcazar and I've started working together, we've had the good fortune of, being able to apply and get several grants funded. So we'll share very briefly about that. We have had the wonderful opportunity to develop partnerships, not only with Providence Health, who's kind of our main partner, but through them, we have had partnerships in the LA region with 14 regional clinical partners, and several of them are also here on this call. And then mainly we'll focus on sharing with you what we developed in terms of our products, our 5-week core training, our 5-month clinical internship, a supervised apprenticeship model, the certificates of training, the continuing education modules, and peer-reviewed publications. This is, in the 5 years, this is something we're super proud of that we did. And then Dr. Balcazar.
Yeah, we also are very, very excited, and we will share that with you, that we have thus far moved 27 graduates, community health workers in cohort number 1 and 2. And the exciting part, which is really very, very innovative and unusual, is to have all of them hire for the first cohort after 6-month training process. And we'll tell you a little bit about that wonderful story, because this is about developing an essential workforce for clinical community health workers. We have also been honored with 2 community awards, the Los Angeles Business Journal Healthcare 2021 Award for Educational Program of the Year, and the St. Joseph's Award for $35,000 cash prize for lasting impact on health and their communities. And being a CDU academic institution, we have mentored 13 students in this academy throughout these years, 6 CDU MBA students thesis. We have done work with 1 CDU postbac student and 6 regional university students, and we will share with you what they have done with their thesis.
All right, so very briefly, we've had the great fortune of having wonderful partners. Cedars-Sinai, really started out with giving us a seed grant on developing this curriculum, which got us going with, the curriculum. And then we started our partnership with Providence, who through a California Community Reinvestment Grant, we were able to also add to that work and add additional modules. And finally, with Dr. Oganimi and Dr. Daskovich here at CDU, we were able to apply for COVID funding through the NIH, and with a main focus on using community health workers as an intervention to improve vaccinations and testing. And this grant is still ongoing right now. This is, we're so happy here to talk to you about sort of the way that we've set up our academy. It's really an academic clinical partnership. And this is very important and a unique aspect of this academy, this partnership between an academic house and a clinical house. And they've been involved in all aspects of, this collaboration, in all aspects of the development of the curriculum. We've had CHWs from Providence giving us input, and we've leveraged, their clinical relationships in developing a network of clinical partners for our internship. So in our collective experience over the past 3 decades of, studying this field, we haven't seen this type of partnership. So this is kind of a unique, innovative, partnership in itself to have this academic and clinical house. We also have our core team at CDU, which includes the two of us and additional, the trainer and curriculum developer. And we've had the wonderful assistance of students from all over. And you can see here, UCLA, UC Davis, UC Berkeley, students that have been attracted to the work we're doing here at CDU and wanted to work with us and intern and provide their time and in turn get some exposure, from this public health work that we're doing. Our Providence core team, we can't say enough about them. They're just wonderful. You see Juan Mendez that Dr. Balcazar mentioned, who is our CDU alumnus. And then, the leadership that was provided, Rosie Salazar, who is the project manager, who's been tireless in working, and Alina, who's the grants manager, Irma, who is a CHW. So we've had just a wonderful team, and Justin, of course, and Jim. So thank you very much, Providence team. I think some of you are here. So I'm just going to very quickly run through, our understanding of who are community health workers. And you can see here, this little image here shows very clearly, that CHWs are the bridge between, as we understand it, between the healthcare, social services, and the community, because they're frontline public health workers and who are trusted members or who have a close understanding of the community they serve. So the way we approached this was that, we found that, besides Juan coming and asking us for help with developing training, we looked at the literature and we saw that there wasn't a lot of literature out there on CHW training, particularly in clinical settings, not on training, not on selection. We also saw that historically CHW trainings have often been developed to support community-based community health workers. So community health workers who work in the community. When community health workers have been trained to engage with patients, typically such trainings have been for more short-term grant-funded projects focusing on a specific health intervention and not often geared towards a long-term ongoing engagement of CHWs employed in clinical settings. So we found that there were no consistent formalized frameworks or curricula reported in the literature for training clinic-based community health workers in the US, although that we know that there are some programs out there, but this was not in the literature. So we saw this as an opportunity to develop something like that. Furthermore, we also found gaps in the policy for the state of California. Fortunately, we have the California Future Health Workforce Commission, which is a key body in this arena, who released a set of final recommendations in February of 2019 aimed at improving the ability of California's health care workforce to meet the changing needs of the state's diverse population. And one of the Commission's 10 priorities for immediate action and implementation was to scale the engagement of community health workers or promotores and peer providers through certification, training, reimbursement, broadening access to prevention and social support services in communities across the state. And by the way, the Commission was composed of a statewide group of senior leaders across multiple sectors and co-chaired by the University of California President Janet Napolitano and Dignity Health President and CEO Lloyd Dean. And we were so fortunate that our own CDU President, Dr. Carlisle, was a commissioner on this report. And so we are just so excited to have this type of leadership right here at CDU. Thank you, Dr. Carlisle. So I want to now move on to what do clinically based community-facing CHWs do? We use this framework, which comes from the CHW Core Consensus, or C3 project, a national gathering of experts who defined CHW competencies and roles. And Dr. Balcazar will talk a little bit more about this report, the C3 project. But if you look at this image, you will see that community health worker roles occur across a continuum. And there's an evolution of these roles from 1.0, where CHWs are based in the community setting, but either facing towards the community or facing outwards and doing outreach. And at 2.0, where CHWs start doing more patient-centered roles, perhaps primarily working in an intervention that's patient-facing. to a 3.0 evolution to clinical settings, where CHWs can be community-facing or clinic-facing. For example, doing more of clinical navigation versus community-facing, where this is more of a bridging kind of role. So in focusing on the clinical space, we at the CHW Academy are most interested in addressing health disparities for under-resourced populations that face tremendous challenges in such clinical settings. We and our partners are looking to develop sustainable systems change through introducing CHWs who are prepared to be part of healthcare teams and organizations, and to be effective bridges between patients and such health systems. So Dr. Balcazar will now tell you a little bit more about how we went about developing our unique approach.
Thank you, Dr. George. Our curriculum development and implementation efforts were based on a timely conceptual approach for the field of innovation, of building this standards-based training on clinical settings. So we defined 6 components. The first was the consultation with community health workers, national experts. The second, utilization of the community core consensus C project that Dr. George mentioned, a very, very important landmark approach and document and project. The integration of 3 key stakeholders: patients, healthcare teams, and healthcare systems. Utilization of popular and participatory educational principles, adult learning principles, and the strong academic building partnership. And I will go very briefly to tell you a little bit about each one of them. The next one, Dr. George. So the first one was consultation. We had a retreat with community health worker national experts, which you can see it to our left. Some may be here today. They represent the field of community health workers for so many years, being experts and being advocates. So the Community Health Academy met with these experts and clinical partners on a 2-day retreat at CDU. That's the Keck building where the College of Science and Health is located. To first of all, review a pre-workshop reflection papers from each expert. We had the joy and the opportunity to ask them their expertise and their reflection of what would it be an innovative standard approach or curriculum for them. And the second one was discussions with a focus on developing an effective framework for the curriculum and adherence to the C3 guidelines, an approach of training that considers the specific needs of clinical settings in variations of these settings, which makes them this very unique, and a strategy for long-term development and integration of this curriculum in training both the academy and clinical settings. The next one. We utilize this very, very important standard-based curriculum that is really timely for the community health worker epoch and where we stand in the field of community health workers. So thanks to the efforts of Dr. Lee Rosenthal and many of their colleagues that have worked for so many years, more than 35 years in this field, and based on their tremendous effort, a national standards consortium was developed with the community health worker communities in mind. So this was developed with community health workers in mind. I was really grateful to participate in some of those opportunities of developing some of this consensus project and the capacities to build for the first time community health workers core competencies in role. As Dr. George mentioned before, it was short-term grant-driven type of training, and this opens up for a component of a C3 that builds up and defines competencies and roles. So the training, the objective was to build that core competencies in role using this framework, and then integrating these standards in 3 ways. Introduce the C3 scope of practice, how learners identify core competence and role using the C3 checklist, and practice core competence and skills during the skill labs among peer CHW learners, which became very important for us as an important component of evaluating what exactly is that standard-based training. The next one. The next one integrated a systems approach that we wanted to build, which is incorporating 3 key stakeholders throughout the curriculum: the patient, the healthcare teams, and the healthcare systems. And that integration was built on 3 key stakeholders implemented through a variety of modular activities: case studies, role plays, group and self-reflective questions, summarizing stakeholders' perspectives at the end of each session, so that by all the modules had incorporating this systems approach of having the patient, the healthcare teams, and the healthcare systems intertwined throughout. The next one. Then we incorporate also popular education, principles of participatory education. Staying in connection with popular education means staying with an engagement process and innovation to build something that means something to people and to communities and to the participants. So we utilize a dynamic engagement process that started with participants, look at patterns, adding information, the practice, and apply that in the context of the curriculum. We utilize techniques like brainstorming, social dramas to build social skits, cooperative learning, role-playing, dinamicas. Popular education has been worked in the C3 and in the community health worker approach for many, many years. And there's been a lot of experts involved in this field that have really helped us to understand this process even further. The next one is the actual adult learning and engagement, which means reaching people where they are at. That's the true nature of understanding communities, to really involve adult learners needing to work with us in planning, to think about the experience that provides the basis for that learning activity, what is relevant to their lives. So important that even in clinical settings, we have relevance. We know that we engage patients and providers in the healthcare system to make that relevant. So we needed to base all of that in a problem-centered approach of adult learning, so that gives us that opportunity rather than only content-oriented approaches. And that, I think, is a very important development that we were able to grasp within that conceptual framework of developing this training. And finally, as Dr. George mentioned, a dynamic, timely partnership to build innovative standards through clinical settings. We needed to build an academic component for the base standard approach that can be recognized at the academic setting, but then move it in coordination with the clinic and like Providence system that has tremendous experience with community health workers. So this was a very timely approach for developing this innovation and building this standards and this training that Dr. George will then mention in the next slides. Thank you, Dr. George.
Yes, thank you. Next I move on to our training and internship. So the first 5 weeks of the training happened here at CDU, and then the next 6 to 26 weeks happened through the internships, but we also had a part to play. It was a continuing partnership. So the Academy is, as I said, 6-month full-time program to train and empower, inspire current and future community health workers. So there were some students who were current community health workers who felt like they needed that training. It included 2 sections, an online and on-site training. For the first 5 weeks, we had them complete the CHW core curriculum. Participants joined live interactive online classes led by CDU. And we had both, the didactic portion as well as skills and role plays in the afternoons in a kind of a lab setting. They got to talk to experienced CHWs, other kind of professionals in healthcare and public health. And then after completing that 5 weeks, participants then moved to the experience at Providence or other healthcare sites for the remainder of the 6 months. They received training on and experience with various roles and responsibilities to improve their ability to care for patients and families. including helping them navigate and access healthcare services, community services, other resources, and adopting healthy behaviors. And they also received monthly education led by CDU. So that's the basic plan. So this slide shows you that there was a tremendous level of interest, given that this was the first time, opportunity that we had to train CHWs. We had 307 individuals who expressed interest in the academy. 189 submitted applications. 100 were screened by telephone. 56, invited to come for an interview, and then 29 were chosen. And 2 of them actually had to disenroll because of other issues that came up. So this slide here shows you very quickly that, that we had our 10 modules, which spanned 3 key areas of focus. In our first area of focus, we established a professional CHW identity and competencies. Now, this is a role that's not commonly understood by many, even in the healthcare arena. And so we needed to first start by helping these trainees understand what this role is, what their identity is as community health workers, and that it requires, cultural humility, self-awareness, et cetera, to work. So these were our first kind of modules, building and establishing a professional identity. And then the second area was, focusing on the context, processes, key actors in healthcare settings, really, introducing these interns to what the healthcare setting is in terms of the, starting with the kind of broad view of what the healthcare systems are in the US, what happens in terms of healthcare teams, interprofessional workplace interactions, also introducing them to public health, technology in healthcare, and then communication and codes of ethics, social determinants of health and equity, and finally engaging with families and communities and the humanistic value of care and management, which is really, the last 3 modules were looking at the forces that shape healthcare and health and outcomes for patients and families. So this is really sort of the 10 modules that we came up with. And here's a sample of weekly schedule. You see in the mornings, we had the didactic part, and in the afternoons, we had skills. And then Fridays, we'd have guest lectures, often from CDU and other places that came and spoke to them. So we had a very lively engagement. So this slide shows you, that we had 14 CHW academic internship sites. And these partnerships, they include hospitals, FQHCs, and other types of clinics. And representatives from some of these partners are here on this call. Thank you so much for your wonderful partnership. It includes Providence Hospitals and Clinics, our main partners, San Fernando Community Health Center, Dignity Health, Cedars-Sinai. And on this next slide, we have Venice Family Clinic, Westside Family Health Center, Behavioral Health Services, Torrance Memorial Medical Center, and Harbor Community Health Center. So really, really fortunate to have such wonderful partnerships. Once our students entered the internship phase, they were not left alone. At each site, they have a clinical champion or equivalent person who helps guide and supervise them. So these assigned supervisors were the primary contact for the Academy's project manager on the Providence side. The supervisors ensured that the interns logged data for monthly report of measurable objectives based on his or her assignment. So like the number of patients screened for food insecurity, number of patients confirmed with appointment at a primary care provider. So they had several different roles. And so these supervisors helped collect that data. They also participated in a number of evaluations, midpoint, half, and final assessments, meetings with the interns, the manager, et cetera, and looking at satisfaction surveys together so that they as a team could collectively figure out how to improve the process. And this is a quick idea of the type of engagement that we had with each of the interns. Not only did they have all these check-ins and evaluations, but they had continuing education from CDU via Zoom. And so this continued all the way through their training. And here you see, our academy as a whole was very concerned about the overall goals of quality assurance and the triple aim. And so therefore, some important goals in healthcare. These are important goals in healthcare. So many of our CHW intern activities were focused on providing linkages, referrals, follow-ups. So you see the type of measurable objectives that were being collected that were very much in the clinical setting, you know, referring patients from emergency departments and following up with patients for COVID services and enrollment assistance and assistance for CalFresh and food insecurity. So very, very important support. And here, this is our continuing education for care management. You know, we realized the goal was to extend, update, and strengthen the training of these clinically based CHWs on care management. So we aimed through this continuing education not only to provide that training, but also to build a sustained learning community for CHWs. And so we've added like a Slack channel. We're adding some social media opportunities for these CHWs as they go through their cohorts to stay connected to the CHW Academy and to continue with this training. And here we have our CHW Academy Internship Training Cohort 1, which went from March to July. Here's an image of our wonderful trainees, and you'll see quite a diversity of people here. We had 11 of them, and these are the types of specific data that were collected. You know, so you see at Cedars-Sinai, they were working with the Healthy Habits program. Dignity Health was doing community engagement for COVID and other issues. Harbor Health, they had them doing medical linkages. And so we have, you know, different types, homeless navigation, enrollment assistance, behavioral health programs. And we have a, a count here of in the matter of 4 months, March to June, March, April, May, June, 12,312 total number of services that we were able to log. And that is with 7,591 unduplicated patients or clients. So this is quite impressive for a first round, you know, in this short amount of time to be able to, you know, have this measured. And as a result, I mean, really, because the training was accepted well, these interns were accepted well, our first cohort was all hired. 7 of them were hired at the internship sites and 4 were hired in other sites. So this is a wonderful achievement for workforce development for our academy, and we're very proud of that. Here you see just one question that, you know, we asked in our evaluation: how would you rate your experience with the academy? And one person here says, I believe this is a great program, hands down. Not only are we learning, but this academy honestly is building better people. We need more of this. This is a grassroots program from focusing on inner to outer work. Truly amazing experience thus far. It was truly gratifying to be at those graduation ceremonies and hear people's stories and really kind of hear this theme repeated over and over again. This is a certificate of completion here that you will see that that describes, you know, what people went through to complete this and to get this certificate. Here's our second cohort. And from here, I will let Dr. Balcazar talk about a few other additional achievements and accolades.
Yeah, thank you, Dr. George. It really has been a joy to work on 3 peer-reviewed papers with Dr. George. We already have published this development of this novel standard-based curriculum that you are hearing today. It's been already published. So we provide a lot of detail on the framework and the rationale for doing this in clinical settings. So that will give you an opportunity to learn more about why it's so important to build some of that effort. And then we also have work on the systematic review of patient-provider feedback on interactions with community health workers, a very important function of understanding engagement, which again can be built on training opportunities. And finally, we engage in a community systems kind of approach for community health workers, building a new era of systems change that we believe we have incorporated some in this training. The next one shows the 2 awards that we received. What is important on this one is to showcase that healthcare can begin to showcase elements of communities with academia for the role of community health workers. So that is really for us very important, to join efforts to really showcase for healthcare the importance of bringing community health workers and innovative approaches of training and practice. The next one. And we also are particularly excited about the students that we have mentored. We have completed so thus far 4 theses, and you can see the titles of the thesis: Trust Between Community Health Workers and Their Patients, from Diana Guzman; Community Health Workers' Perspectives and Integration into Clinical Work Settings, which is important, from Ahmed; Tatiana, a qualitative case study for clinical community health worker; and Sarah from talking about organizational readiness, a very important component of understanding how clinics and systems are ready to bring community health workers. And Jordan and Sean are working on their thesis, and they're in progress. Thank you, Dr. George.
All right. Thank you. So we wanted to share with you sort of our next steps in terms of this academy. We are in the process of developing and completing an evaluation process. As you can see, we've been collecting a lot of data. We're at a point of trying to go through and really try to understand, what we have accomplished, how can we improve, et cetera. Our big goal was to see these interns obtain full-time employment, and we are so proud of the ones, our first cohort. Our second cohort is just completing their internship now, and just given the response of our partner clinical sites, we're very hopeful that we can get them into full-time employment as well. Our ultimate goal is to see healthcare organizations incorporate CHWs formally into healthcare teams, and to have sustainable ways to, keep them going in those roles, much as the California Healthcare Worker Future Commission, mentioned, this is or concluded, this is really an important piece for the state of California to start having opportunities to do that. And then ultimately creating a larger network of healthcare organizations who participate in this academy. And in terms of that, we are now on the cusp of some very exciting developments, CHW funding opportunities in the state of California through the expansion of Medi-Cal. Then specifically, I'm talking about the California Advancing and Innovative Medi-Cal, or CalAIM initiative, which creates new imperatives for managed care programs to support non-clinical interventions to address health-related social needs and to reduce health inequities, including through partnerships with community-based organizations and providers. And so, areas that are really focused on social determinants of health, and these are the areas where community health workers can really shine. And there are a couple of funding opportunities. These MCPs or managed care programs can either contract with the organizations that directly train and employ CHWs, or contract with community partners that train and employ CHWs. So this could be a very exciting space for the Community Health Worker Academy as these opportunities open up. And additionally, California is pursuing approval from the Centers for Medicare and Medicaid Services to use federal funds to support these CHWs. So, we are so excited to see how, especially in a post-COVID world or in a COVID world, as we realize the need for this sort of support, that, these initiatives really take root, and that, we will see this approach, which is really about equity, and addressing health disparities in our state. This is also very exciting. This is just the face of a report. So the California Healthcare Foundation has been doing a series of reports over the past year in preparing for CalAIM, and specifically looking at the role of CHWs. And in this report, on the page entitled Resources and Tools on the left-hand side there, you will see that they have listed our academy as the only organization in Los Angeles County that develops and leads employee-sponsored trainings. So this is a really nice shout out for us, and hopefully the beginning of, wonderful opportunities for us to build on this work and to be a resource for our state's needs. So finally, led by our clinical house partners at Providence, we've been engaging in a strategic planning to bring together our key goals, both short and long term, and assessing what value we bring through the work that we do and how that matches with what is needed at our state level, especially with these new Medi-Cal initiatives, and which additional stakeholders and partners may be interested in joining with us. So that's where we are with our Academy. We're very excited about the next steps for the Academy. And I think that's it. So we're really happy to have shared this with you, and we look forward to any comments, questions, and a discussion.
Thank you very much. Yes, Dr. Bazargan, I see your hand raised. Thank you, Dr. George and Dean Balcazar, for a wonderful presentation.
Outstanding presentation. Thank you to both of you. I was wondering if a different version of this academy for training, for this training could be set as an elective course for public health, Master of Public Health, as that maybe other programs such as the School of Nursing, PhD student for nursing practitioner could take that this course. Have you explored this idea with Dr. Islam, or is it possible to have an elective course here at CDU for Master of Public Health?
Well, I'll begin. Thank you, Dr. Bazargan. I think that yes, building that effort of some credit type for some opportunity for our students or nurses or medical students is something that can broaden the perspective of the academy for training purposes. So I feel that that is a very opportunity that could be very fruitful. Dr. George, do you have any additional comment?
Yeah, no, I think it's a wonderful idea to be able to provide credit where we can, because we want to see these CHWs, building on the training that they're receiving. And if that can be the basis for additional credits that they can get to move on and develop in their careers and go on to get bachelor's and, masters and other degrees, that would be a wonderful basis to start from, where this training becomes a part of that building process for them, and where CDU can be a space that can support them in all of that training.
Thank you.
Thank you, Dr. Bazargan, for your question. Let's see, I also see Dr. Islam, your hand is raised. Would you like to ask your question?
Yes, can you hear me?
Yes.
Yes.
Yes, good. Yeah, no, I just thank you, Dr. Bazargan, for bringing this up. Actually, we are definitely very open for an elective course for our undergraduate and graduate public health students. I think this would be an excellent addition to their skills. So yes, count us in. We can discuss more moving forward. Thank you.
Great. Thank you, Dr. Islam. Let's see, just going through the chat, lots of comments, wonderful work, wonderful presentation. Question from Annette Maxwell. What is the background of the trainees? Is this full-time training for 6 months?
Yes, in fact, it is through the program that we've, the funding that we received through the California State and in partnership with Providence. That is what we were able to offer as full-time training, the 5 weeks with us and the 5 months really in the clinical sites. And in terms of background, we've had quite a variety of people that have basic high school education to some that even have a college education. So we've had, a spectrum of kinds of people that have been attracted to this work and this profession.
And they were paid for it, so that So this was a paid component of the training.
Kiosha, I had seen our partner from Providence, Jim Tehan, had his hand up. I don't know if he's still wanting to make a comment.
Let's see, I'm not sure. Mr. Tehan, feel free to unmute yourself if you would like to make a comment. I also see Roger Williams. Your hand is up as well. Feel free to ask your question.
Sure,
No,
great, thank you. Oh,
Oh,
go
I'm
ahead,
sorry.
Jim.
Go ahead,
Hi, Jim.
Roger. Go ahead, Roger.
Nice to see you, Jim. And you know, this is such a great program. Congratulations. And I'm glad to hear this kind of success. My question is, there is currently an initiative being developed through Medicine for the Greater Good at Bayview Medical Center at Johns Hopkins. And the program is to put in place community health stations where members of the community can come and get community health information, and it's all available to them free at no cost. And so part of the program is also focused on training of high school students toward community health worker credentials. And so I'm just wondering, what are the opportunities for partnership with the Academy in that regard?
Dr. George, you want to?
Actually, you know, can you answer that one?
Oh,
Dr.
sure, sure. Well, actually, thanks for the comment. I believe that, as you mentioned, having community sites or places where where communities can come and get access to services is fantastic, and building a model there of competencies that can really go from adult learners through high school learners is equally valid. So I would say that there is really an opportunity to build types of collaborations that bring the opportunity to establish what kind of clinical value or value for outcomes a standard-based training may look like under such a system. And I think that that's where really the purpose is, to learn in an academy how best to really disentangle this opportunity for community health workers to bridge settings in clinics in different modalities. So I would think that that would be a very exciting venue because of the fact that you begin with a core element of competencies and role that should be across the board, no matter where you are, which is important versus just thinking of a minor component of a clinical-based disease like diabetes or hypertension, which is equally important to treat it. However, the broader basis of competences can be built within that setting that you described, Dr. Williams.
Let's see, other questions in the chat?
I have a question.
Oh,
Sorry.
oh, absolutely, absolutely.
I wonder about the opportunity to bring more young African-American young people into this exercise, because often it's language and culture of other communities. And at THE, we had like an Asian health project for 11 different API communities. But there's a cultural gap for African-American community members as well. And if you are in a majority white or majority Latino community and you have Black patients coming in, it would be wonderful to have a community health worker there to assist both staff and the patient, bridging everything. We didn't do a very good job of developing that at THE, but I hope going forward that we can sell the program to all communities, so that that cultural gap is something that is somebody in the clinic or the hospital can deal with effectively.
Yeah, Dr. George, you want to?
Yeah, well, thank you so much, Sylvia, for that comment. You know, we really, you know, at the stage that we're at with the way we presented it, we've tried to make it so it's not specific to any community, but we talk about the importance of cultural sensitivity to the patients and to the contexts in which these community health workers go and work. And so at the place where we are training them right now, because we don't have a specific relationship to a particular type of clinic, they could be placed in any clinic. So we're training them at a, you know, sort of at a broader level to say, you need to be, you need to first understand, you know, what the cultural context is and the patients, but there may be opportunities to actually partner with particular types of clinics, you know, that have certain types of populations and tailor our, you know, training to those types of populations. So that could really be something we could look for as we expand.
Well, you've advanced the practice, you know, eons beyond where it's been. So I'm just so tickled to hear what you've done and how welcome those you've trained have been accepted immediately. I mean, that speaks volumes for the program. So thank you both so much.
Thank you. Thank you for your comments, Sylvia.
It's beautiful.
Thank you for your question and comments, Sylvia. Let's see. I'm just looking in the chat box. Dr. Batgama, fantastic job and accomplishments, Dr. Balcazar and George. Well done. A question from Dr. Sadiq. Thrilled to hear about your work as a nurse scientist, interested in the role of community health workers and community navigators. What sort of outcome measures do you think would be important to consider when examining the effectiveness of community health workers and community navigators?
Well, yeah, the very good question. I'll begin and then Dr. Georgia. I think that there is also a new generation of community health worker researchers and people that are very interested in understanding outcomes from many different perspectives. We showed, for example, certain outcomes that the community health worker was involved with in the different kinds of settings, in the clinic settings, and then you can begin to start thinking that you could broaden some of those outcomes to start approaching patients' satisfaction and other kinds of measures that perhaps have not been developed. But now, critically important is this development of a field of evaluating community health workers with different type of assessment tools that right now is happening in the country, that with a group of researchers from all over the country who are trying to understand different assessment tools for measuring different things in settings that community health workers are part of. And so we hope that this can begin to continue the process of understanding that, the same way that I saw another person was talking about cost measures and cost effectiveness and what is the cost that you can reduce by really having a community health worker in the system. We want to learn more about the readiness of systems to really vet this type of approach, and now with CMS and others, you can begin to start envisioning specific outcomes for diabetes and other measures that can be critical for understanding change. And so that, again, the important will be to have a consistent long-term relationship between the system, the provider, and the patient, and the community health worker. And those models are not right now all over the country. There are very few like that who have that approach in clinical settings where the system is ready, where there are patients and providers, where there is reasonable approaches for supervision, and that is an area where the field is moving rapidly.
Thank you very much. Let's see, moving, oh, I'm sorry, Dr. George?
Oh, I don't need to say anything more. I think Dr. Balcazar covered that well. I want to open it up to any of our Providence partners, if anyone wants to jump in and say something about, because, you know, they've been very much partnering with us in the evaluation process. I don't know if anyone's still on, but okay, please go ahead, Kiyoshi, if no one else is.
Dr. Bazargan has his hand raised.
Thank you again. We have a large number, Dr. Balcazar, Dr. George, we have good number of research assistant and research associate that they are in charge of recruiting and retaining participants for clinical and non-clinical research in our CDU research community. They are not necessarily community health worker, but I think that they could significantly, learn from this training if you could put together specifically a workshop for them that also include the community faculty, who are some of them has responsibility currently for recruiting and retaining vulnerable population and hard to reach and hardly reached individual in the research. So would you please consider that one to put together a workshop for them as well? Thank you.
Thank you, Dr. Bazargan.
Let's see, I see Dr. Kagawa Singer, your hand is raised.
Hi, can you hear me?
Yes.
Oh, thank you. Well, congratulations to both of you, Dr. Balcazar and Dr. George. My question has, having worked with community health workers for many years, was one of our goals or hopes, and I'm wondering, since you're based at Drew, is giving college credit to the people who go through your program, because that enables them to enhance their own professionalism and builds the capacity of the outreach workers to be able to gain more education within your program, but also a motivation to go on as well. I'm just wondering if you considered that.
Yeah, thank you for your question. Actually, we did that. If we were to think of the conversations that we had with our Providence partners, and this element of credit became as an element of discussion. So I think that yes, in the context of learning how best to incorporate different elements of opportunities for community health workers in many different ways, I think is very, very important. So at this moment, we have concentrated on the aspect of the building that opportunity of the curriculum training, developing the standards, developing evaluation and parameters, looking at continuing education, really carefully determining how the competencies and skills were integrated into the quality assurance. So we have concentrated the efforts there because we believe that we have to have a good base standard approach to training, so that when a clinic begins interested in and say, what is the training that we can feel comfortable with, to try to embrace that as a job description with community health workers, that we are part of that process. So to enable then community health workers to move on into that realm, but definitely the realm of learning opportunities for themselves, to give them credit is something that to be considered as well.
Great, thank you very much.
Yeah, I can add to that, it's all the things Dr. Balcazar said, but, as you know, and you've said this to me before, the big challenge is, sustainability, right? In terms of being able to find ways to pay for that training. And so we are hopeful that, with this new opening up of Medi-Cal and these initiatives, that there will be incentive and possibly funding to really develop programs that are long lasting and sustainable, and that can, bring about that systems change that we are hoping for through, training these community health workers.
Mhm. Great, thank you so much, both of you.
Thank you very, very much. I'm going to, let's see, I see other questions in the chat, but in the interest of time, I definitely want to provide an opportunity for our provost, Dr. Steve Michael, to say some few words and remarks. Dr. Michael, thank you.
I'm wondering if you want to take the questions. So
okay, I just wanted to be mindful of your time, sir. But thank you.
Right.
Thanks.
Okay. Thanks.
Okay, so let's see. Our next question in the chat is from Dr. Chavez. Conducting community health work to bridge different cultures can be challenging in regards to identity, values, and mental health. Any lessons learned about well-being, wellness hurdles, or achievements from engaging community health workers in addressing inequity?
Yeah, well, maybe I can say a few things. Based on the experience that we had with the two cohorts, we saw a lot of suffering of community health workers trying to address their own issues and still maintain the level of professionalism that they have for keeping up with the very, very 5-week training plus the 6 months. We saw a lot of different types of opportunities for them to really understand and share. Remember, we talked about the sharing of experiences, that we had created a place, a safe space where they can talk to Rosie from Providence, or they can talk to some of our community health workers, the trainers, or with the other community health workers, to really share the difficulties and the types of challenges that they have. So it was nice to see, as the person said, that this was really a true effort from the grassroots component, to know that they are human beings, that they do have difficulties, and that they have some stressors and mental health issues, but they are resilient. They cry, they embrace each other, but then they continue to follow up because they want to have that certification. So I agree that we have to be very careful in trying to bring them the training. And that's what at the beginning we talked about, the essence of being a community health worker and knowing themselves a little better, their identity, because that is a human identity that they have, as well as their own work. So definitely it is very important, because we hope that when they then approach the patients, work with the providers, and they can begin to start working with them in an engagement process that is rich for the patient and for the community health worker, so that they could begin to start establishing a rapport, so that their disease can be diminished, so that they can, the risk factor can be positively affected, and so forth.
Thank you. Let's see, I do not see any additional questions in the chat at this time. I just wanted to provide others opportunity. If you haven't already done so, you have a question, feel free to unmute yourself and ask your question. or if any other community partners would like to say any words at this time, we're definitely opening up the floor to you. Great. Okay. Thank you so much, Dr. George and Dean Balcazar, for a wonderful presentation. Your work is phenomenal, innovative, exciting, timely. We thank you, and we look forward to supporting the Community Health Worker Academy and really seeing its future unfold. At this time, I'm going to go ahead and turn things over to our provost, Dr. Steve Michael, for closing remarks.
Thank you very much, and thank you to everyone who is participating in this excellent presentation. Just about the time you were about to call me in, I have one of my staff that just came in with twins, newborn babies to my office. So I had to run out to hug all those babies and then run back in order to give this closing remark. First, I would like to thank all the sponsors. We talk about UHI, of course, with Dr. Patlow as the director of UHI. Thank you for the work that you are doing. And obviously the president, who is the PI of that UHI. Unfortunately, we are not in the same place. Otherwise, this is the time I ask you all to just put your hands together and be thanking all the sponsors. So wherever you are, please just continue to do that for me. All right. Let's also thank all the funders, the Cedars-Sinai. You've heard them mentioned several times. So thank you for the excellent support that you continue to provide to us. Dr. Balcazar and Dr. Sheba George, what a very, very wonderful and excellent presentation. You make me proud, as a chief academic officer. So I'm going to speak about what I consider characteristics of innovative, a model as a way of summarizing everything that I'm talking about. Because people like me, since I'm old, I've been around for so long, when I hear some of these things, I'm thinking about those kind of characteristics because those things are actually publishable in terms of, innovative models. So I just want to thank you for the amount of work that you guys have put into it, even as a dean, as vice president of the Senate. You guys are busy doing all this great work. I have tons of questions, but I take it that I'm going to be able to ask you in person. For example, how was COVID? How did COVID impacted what you guys are doing? Did you have to set them up with technology to do Zoom and all these kind of things? There's so many logistical things that I'm sure you guys walk through in order to be able to get this done. Ms. Silva, Drew Ivy, thank you for your presence, and all the team that help you all to pull this lecture together. Thanks very much for everything that you are doing. In the interest of time, I'm going to summarize very quickly. So when I'm listening to things like this, first, I have a number of questions in my, on my mind. The first one is, to what extent is this project, this initiative, mission-centric? And when I look at it, this is very much in the heart of the mission of Charles R. Drew University, in the sense that you're training leaders. When we said health professional leaders, we didn't mean people with PhD only. Okay, it could be any level, because you have leaders in all careers and also diverse. When I look at the population that you are that are in your cohort, the diversity is quite impressive. When I look at the issue of social justice and health disparity, that's exactly what you guys are doing. So this is very much mission-centric. It's also value-based, because if you look at the strategic plan of CDU, what we call the clinic value. The very first thing there is what? Community. Okay, and that is exactly what you guys are working on, making sure that community engagement, empowerment is centric to the work that you are doing. You know, I look at the CDU advantage, and I mean, and all the elements there. I'm trying to tease out in the pedagogy or andragogy and all the things, curriculum that you put together, and I'm sure that you guys were touching all those elements. The second point is that what is the impact on students? And I was so happy to see the number of students that this project impacted. All right, not just CDU students only, but even students from other institutions. And then in terms of impact, does it result in learning, in growth in the student? And that's again part of the things that you are demonstrating, you know, and using a mentoring approach, being close to all those individuals. I saw that you have about 300 students and you narrow it out to 29. Part of the question on my mind is, okay, so what are the criteria for weeding out until you get out to that 29? Again, that too will be very insightful. So I truly appreciate what you are doing with regards to that. And the last point here with regard to students is the placement. The idea that these individuals, as you're working on them, were able to get job placement, which is very, very important, as you know, that will not only graduating people, but making sure they get jobs and well placed. To me, when I saw that, I got excited again. The third characteristic is the extent to which this particular project broadened partnership and remove us just from an ivory tower that continue to just crank out own papers and others, but it got you to have partnership, you know, partly because you need their help, you know, those partners, and partly because also working with them actually is extend the effectiveness of this particular initiative. So I want to thank all the partners who are here, the external individuals who are. The success of this project is your success. And you now see that by working together, we leverage our strength, okay, to the benefit of our community. So, you know, the third element is that the broadening of partnerships into entities that otherwise may not have come together, and leveraging all those collective assets is also very, very important. The other thing that I'm looking at, number 4, is does it enhance faculty productivity? You know, in the sense of all of you, the work you do as academician, does it broaden it? Does it extend that? And does it lead to, number 5, does it lead to innovative, creative system approach? And I see that woven in throughout everything that you are doing. You know, it's quite innovative. Number 6, is it replicable? Is this something that other people can build on? Is it a technology that can be extended to other people? Can people actually follow what you have done in other settings and then have a similar result or even better result? Can people build on that? You know, and again, that's another excellent characteristic that I've seen. And then the last one, does it lead to publications? You know, I was so excited to see the number of publications in different journals that have. You know, so when I look at all these things, and as an old chief academic officer, looking at all those kind of characteristics, I have goosebumps. So because I'm checking all these things and saying, oh, that's another paper, you know, that can come out of this. Okay, using all this kind of criteria that we use in evaluating model, new innovative models, you know, that we tend to talk about and publish in the literature. So again, you know, I can talk forever, as you know, because I'm so excited about the work. I see what you guys have done, and to be very candid, I know that the students that participated in this, you know, who have good jobs going on, have great things that they are saying wherever they are, because you have touched their lives, you have transformed, you know, their career. And the entities, organizations that employ them are reaping the benefit of that. So again, thank you to the sponsor, thank you to the listeners, the audience, thank you to the presenters, and God bless all of you. Thank you.
Thank you very much, Dr. Michaels. Can you please advance the next slide? So at this time, we just wanted everyone to join us in honoring Dr. Balcazar, Dean Balcazar, for his service in the field of public health and also his extraordinary contributions to the CDU community. Many of you on the call know that he is going to be retiring in 1 month. I'm sure he's still going to be partnered with the Community Health Worker Academy as much as he can. But we just wanted to honor him and take this opportunity. I know that there's going to be other celebrations that's soon to come, but we want to honor him in this space as well. Thank you, Dean Balcazar.
Thank you. Thank you so
Fantastic.
much.
Great job.
And thank you very much, Dr. George, Dr. Balcazar, for your fantastic presentation. Thank you all for joining us today. We will make the recording available and we'll send out the link to the recording to all registrants. Have an amazing rest of your day, and thank you